Dear students, Assalamu alaikum. I hope you will be doing well. This is the lecture of gross anatomy upper limb. The topic is the anatomy of axilla. I am Dr. Karimullah, Demonstrator Anatomy Department, GKMC Swabi. The objectives of today's lecture will be to define the axilla, the shape of the axilla, to describe the boundaries and the contents of the axilla. The axilla is an anatomical area. It is in between the upper part of the thoracic wall and the lower part of the neck and the upper part of the arm region. The location is between the upper part of the arm and the chest wall. It is pyramidal in shape. It gives passage to various structures between thoracic wall, the cervical region, upper limb, and this is also called the cervico-axillary canal. It gives passage to branches of the brachial plexus and the axillary vessels. The boundaries are the apex, the base, the lateral and the medial wall, the interior and the posterior walls. The structure of the axilla. The apex. The apex faces upwards and to the neck in the posterior triangle. The posterior triangle is formed by the trapezius muscle behind, the sternocleidomastoid muscle in front, and the base of this triangle is formed by the clavicle. The base of the axilla faces downward. Now the apex in somewhat detail, the shape of the apex is truncated. It is bounded anteriorly by the clavicle, posteriorly by the superior border of the scapula, medially by the outer border of the first rib. These are all shown in the diagram given on the right side. Now the floor or the base of the axilla, it is directed downwards. It is formed by the skin and the fascia stretched in between the interior and the posterior axillary fold as shown in the following diagram. The anterior axillary fold is formed by the pectoralis major muscle. The posterior axillary fold is formed by the uh, tendon of the latissimus dorsi and the teres major muscles. Medially, it is bounded by the chest or the thoracic wall. The walls of the axilla, the anterior wall, it is formed by pectoralis major and clavipectoral fascia. The posterior wall is formed by subscapularis muscle above and the teres major and latissimus dorsi tendon below. The anterior wall is shown in the slide by the diagram on the right side, and the posterior wall is shown on the left side. The medial wall of the axilla. It is formed by the upper four ribs with the intercostal muscles, the upper part of the serratus anterior, and the long thoracic nerve which descends from above downward upon the substance of the long thoracic, the serratus anterior muscle. The lateral wall is formed by the upper part of the humerus, the coracobrachialis, and the short head of the biceps muscle. The contents of the axilla, the axillary vessels, the infraclavicular part of the brachial plexus and its branches, the five groups of the axillary lymph nodes, the long thoracic nerve, and the intercostal nerves, the axillary fat, and the axillary tail. In the diagram below, the axilla has been shown from the front. You can very well see the cords and the axillary artery and the axillary vein with its tributaries and the branches. In the diagram on the right side, you can see the axilla from anterior to posterior. The important points have been shown in the rectangles. Now the axillary lymph nodes. These are five groups of lymph nodes. The lateral are the humeral, the interior are the pectoral, the posterior are the subscapular, the central lymph nodes, and the apical lymph nodes. Now these lymph nodes one by one. The lateral are the humeral lymph nodes. Their site is they lie along the axillary vein. The afferent they receive from the upper limb. The efferent they go toward the apical and the central group. The anterior are the pectoral lymph nodes, their site of location. They are lying lower at the lower border of the pectoralis minor muscle along the lateral thoracic vessels. The afferent coming from the region above the umbilicus and the mammary gland, and the efferent goes toward the apical and the central group. The watershed area, an imaginary line drawn upon the umbilicus at the level of the lumbar 2 and lumbar 3 vertebrae. The area above this watershed line is drained by the axillary, interior axillary or the pectoral lymph nodes, and the area below this particular line is drained by the inguinal lymph nodes. The posterior or the subscapular lymph nodes, their site of location is the posterior axillary wall along the subscapular blood vessels. The afferent they receive from back above the iliac crest and the tail of the breast. The efferent they go toward the apical and the central lymph node groups. The central lymph nodes of the axilla. They are embedded in the axillary fat. Their afferent comes from all the previous groups of lymph nodes. Their efferent goes toward the apical lymph nodes. The apical lymph nodes. Their site is near the apex of the axilla. They lie. Their afferent comes from all the previous groups and the upper part of the mammary gland. Their efferent form a subclavian lymph trunk which eventually enters and poured or drained toward the in the subclavian vein. Students, the clinicians or the surgeons, they used to take the axillary lymph nodes into three levels: the levels 1, the level 2, the level 3, and they have taken the pectoralis minor muscle as a standard. The groups of the lymph nodes lying at the lower edge of the pectoralis minor muscle are the level 1. The groups of the lymph nodes lying beneath the pectoralis minor muscle are the level 2, and the groups they lie above the medial border of the pectoralis minor muscle, they are the level 3 groups of the axillary lymph nodes. The lymphatic drainage of breast is of great importance in spread of carcinoma, and about 3/4 of the carcinoma spread occurs to the axillary lymph nodes. Students, with this we came to an end of today's discussion. Next time we will come with a new topic, the inshallah, the brachial plexus, inshallah. And till that time, God may bless you, and please remember me in your prayers. Thank you very much.